Thank you, everybody. Thank you for the invitation to speak. Is it closer? Okay. I too have a disability, and that is hearing, and it's getting worse with age. And so I hope you'll bear with me when we get to the question and answer period. I'd like to give you a little overview today of a subject that I've been very interested in for about 38 years now. And it is a brain condition, but it is a syndrome. It is not a genetic diagnosis like you're familiar with. It's very common now and becoming more common just in the last few years. When I started out in the mid-'80s, it was 1 in 2,000. It was pretty unusual. But by 2008, it was 1 in 88, 1.1% of the population. 2 years ago, it was 2.3%. And just in the last 2 years, it's jumped up to 2.8%. Now, some of this increase is clearly due to recognition. We're much better at recognizing it now than we were before. And in the last 2 years, there's been an increase in diversity in the patient population and recognizing this in all types of people from all backgrounds. And now the boy-girl ratio, which has been 4 to 1, is now the number of girls that we're detecting is increasing somewhat, but although there's still a preponderance of males. It has a complex genetic basis, unless you happen to have a specific genetic diagnosis. That is, it's been thought that there are multiple genes involved and they interact in certain ways. And we know that there are environmental influences as well, and I'll talk about that in a bit. And it is a very expensive thing for our healthcare system and for all of us. Autism spectrum disorder, it's a spectrum, it's a syndrome, a collection of symptoms that have been recognized since 1944 when they were first described by Leo Kanner at Johns Hopkins. As it happens, he was in the Department of Psychiatry. I was in the Department of Neurology, Pediatric Neurology, right next door, across the wall, and I didn't get much exposure to it. I didn't know what it was until I happened to be in practice years after that, when speech therapists started bringing me patients and saying, can you recognize this and help with it? It is primarily a deficit in social communication. The number one factor is social. The social ability to interact socially. And there are deficits in nonverbal communicative behaviors and so on for social interaction. But the primary important factor is ability to communicate socially. And secondly, you have to have restricted, repetitive patterns of behavior, interests, or activities. And then at least two of the following. So here again, we are defining this as to what we see in the person. Can I just ask for a show of hands, how many of you are familiar with the subject of autism? Oh, I'm speaking to the choir. It is around us everywhere. You see it more and more. And as I said, it's increasing. We think that about 40% of people with autism can be explained on a genetic basis. We don't have the genetic diagnosis exactly in all of them, but we know we're getting better and better at ferreting out the genetic causes. And this is the aim of the field. And you are really critical to the process. About 20%, we think, have prenatal origins. And these, I'll speak to this, these can be many-fold. There are certain drugs we know that probably play a role if the mother is exposed. Things in the environment, air pollution and so on. And then there are different features of autism that go with it. Developmental delays in speech and motor function, intellectual disability, learning disability, deficits in social communication, ADHD is very common. Anxiety disorders are very common. Sleep issues are a big one. And GI, gastrointestinal, and seizures. Seizures occur in about 30% of the children overall, usually starting in puberty. Many genetic syndromes have been described with autism. One of the first ones was actually Rett syndrome, and at one point, until about 10 years ago, Rett syndrome was actually included in the classification of autism, and then it was removed because it had a specific genetic diagnosis. And anyway, girls with Rett syndrome are a little bit different than most people with autism. And you'll find that whenever you see a specific diagnosis, genetic diagnosis, that person is a little bit different than the average person with autism, whatever that means. And I have to point out, there's a saying in the field of autism: if you've seen one person with autism, you've seen one person with autism. Because there are very few people, two people with autism who are alike, even identical twins, and I can swear to that, can be different. So we have a number of syndromes, in addition to Rett syndrome, neurofibromatosis, Down syndrome. Quite a few children with Downs have symptoms of autism. And you can see here a whole list of them. When we get down to some of the more recent ones, KAT6A and B, I wasn't able to find anything in the literature about autism in KAT6B. I'd be glad to hear if any of you have experience otherwise, but from what I can tell from the literature, in type A, it's somewhere between a quarter and a third. If you know different, let me know. Environmental risk factors. There's a list we have for which we have evidence. Advanced, actually, parental age, both mothers and fathers, prematurity, birth trauma, so on. Many factors here that we list under environmental. Here are the prenatal valproic acid and a drug called terbutaline that used to be used. It's an asthma drug that used to be used to stop premature labor, which isn't used for premature labor much anymore, thank goodness. There's weak evidence for vaccination in certain circumstances. Maternal smoking, inorganic mercury, summer birth, and so on. So a lot of epidemiological studies have gone into this. As I mentioned, the cost of autism is tremendous, and these numbers are out of date. 126 billion, this was at least 10 years ago. And the US Navy budget that year was 150 billion. So you can see it is a huge cost to everyone. Comorbidity is significant. Anxiety is such a tremendous problem that people with autism have. Very subject to depression. There's a link to bipolar disorder, and some families, particularly OCD, obsessive compulsive disorder, Tourette syndrome, and the big one is ADHD. I put seizures separately down here because They come on later, and they're usually not directly associated with the other factors. You're all familiar with this, I'm sure. Sleep issues are a tremendous problem for families, and parents are exhausted. We do our best to try to treat these in various ways. There are no easy answers to sleep issues. And again, they're very individual. You can't treat all the people the same. And it's not just in childhood, although they tend to get better with age. They are often lasting well into adulthood. The GI problems are manifold: constipation, diarrhea, feeding difficulty, food allergy, colitis, and reflux are common issues. A lot of our patients see GI specialists. Now, I'd like to talk about the blind people and the elephant. And this is our approach to research. Everybody doing research has a different, feels a different part of the elephant. Dr. Kelly is very familiar with mitochondrial issues. There are people who think that immune aspects, which I worked on for some years, are important in autism. And then there are those who work with the GI tract and prenatal infection. But everybody has a different approach, and that's great. And it's great to have meetings where we talk and we share in the literature and in conferences. I put this slide together recently to try to illustrate that all children who are evaluated, and adults too, who are evaluated for autism, go into the pot. This is the pot. This is the pot where all people that I see go in. They go into the pot that's called autism, and we stir it. We stir it, and we keep stirring it. And as we stir it, we send every patient for a genetic evaluation. And we've been blessed over the years with good genetic support and a lot of good research, which you're aware of, that goes into diagnosis. And if you get a diagnosis, a genetic diagnosis, you'll come out of the pot. You're not in the pot anymore. You'll have a diagnosis. You can still have autism and have a genetic diagnosis, but your genetic diagnosis is primary. That is leading us to an understanding of the underlying biology. I see leading us to, we don't always have the final answer, but it next goes to research and eventually specific treatment. All children get treatment. All children with autism get treatment. ABA, applied behavior, speech and language therapy, OT, and of course medical therapies. But for purposes of diagnosis, they go back into the autism pot. And then we keep stirring, and we keep stirring. And as new genetic information and environmental information and other causes become apparent, we keep working at it. We never stop. You may have heard the FDA just approved trofinetide for Rett syndrome. This is a great advance. It's been in the offing for several years now. And the drug trofinetide is an analog of IGF-1, the growth factor, and it alleviates many of the symptoms of Rett syndrome. And it's very expensive, unfortunately, which new drugs always are, but it's very promising. These are girls with Rett syndrome, typical hand-wringing movements, and many of them have features of autism. The brain is a complex organ. It's our most complex organ. It's the one that makes us most human. The GI tract is next, and the GI tract is like a brain in itself, as it has many nerve endings and neurotransmitters similar to the brain, serotonin in particular. Our brains have 10 billion neurons, nerve cells, and 10 to 15 quadrillion synapses. 1 quadrillion is 1,000 raised to the power of 15. So you have a nerve cell, but it's the connections. These are called synapses. These little dots on the dendrites here are synapses. They're the connections with all the other nerve cells. One of the remarkable things that was found some years back is that there's actually overgrowth of the brain, particularly in male infants. You can see here over the first few months, the brain actually grows too fast and they become macrocephalic. The heads are too big. This is not in all patients, but in quite a few. And then it tends to level off and even decrease some over time. So this is one of the many remarkable things we see about the brain in autism. And the brain is structured in the cortex with channels up and down from the surface going down into the depths, what are called mini columns. And their neurons are arrayed out and in fashion, and then they connect from one column, many column, to the next. There are millions of these, of course. And it was discovered some years back now that there are too many columns in children with autism. This is a control, 4-year-old. You can see that the up and down columns here, and below here is a child with autism. You see how much more densely packed these are, the cells and the columns. There are too many cells and too many columns because there's a failure to reorganize, to actually cut back the number of cells and the number of connections, to refine them. Many, many mysteries. There are also patches in the cortex where there's missing links from one part to the other. You can see here where it's disorganized and these patches appear. So something is interfering with normal development, and it could be in many ways. What we're looking for is how connections are made. It's the connections in the networks that are set up that are so important. So this is a diagram of connectivity and control on the top. These are young adults. You can see how they're much more compact in the control compared to the people with autism. They're much more diffuse. And there are too many short-range connections and not enough organized long-range connections. Now, this is an interesting study. Now, I'm going to show you some studies where people are trying to look at networks using MRI and looking at the activity on MRI scans. This is what we call functional connectivity. And along the top row here are a control group. And these are young children, the average of 2.5 years. And what we're looking at here, the activity in the frontal lobes. The frontal lobes, where a lot of our decision-making takes place, as they are connected to one area called the right temporal lobe. But down below here you see the children with autism, and their main activity is in the back of the brain, the visual area of the brain, where our vision takes place in the brain, called the cuneus and the precuneus. And this is where their activity is, not in the frontal lobe. So this, I think, dramatically demonstrates that this problem with connectivity is present early on. And this is a study looking at the width of the gyri. The gyri and the sulci are the hills and valleys on the surface of the brain. The gyri are decreased compared to control in this area, which is a language area of the brain, and they're greater in the occipital area, as we saw before. So there's an emphasis on the visual aspects, visual functions. And this is a diagram of areas that have decreased or hypo-connected networks in autism here and hyper-connected networks here. Now these are very elegant studies, and they're wonderful to see. You can see them online anytime. What I would like to see, and I'm really hoping somebody doing this work will do, is to study patients over time with therapy. Because we know that children can improve, and often do improve with certain types of therapies. And we would like to know how that is affecting their connectivity. Stay tuned. So there are many potential causes and therapies for autism. You're probably familiar with mitochondrial dysfunction and its treatment. There are people trying to treat neuroinflammation with anti-inflammatory agents, and treating with SSRIs, antidepressants and antipsychotics, trying to change neurotransmitters, glutamate, hormones, immune regulation, and so on. These are all different approaches that are possible, and different people are working on them in different ways. All people trying to get their hand on that elephant and trying to describe that elephant as best they can. I want to just point out this website, if you're not familiar with it. It's called Spectrum. You can get it online every day. It comes right over your phone. It is a wonderful thing. It's put out by the Simons Foundation, spectrumnews.org. And here are two articles I found right away. And they have an archive. They archive everything from every day's news on autism, from clinical to research, every aspect. And this was the first one in March 2020 by Jill Adams, describing KAT6A. And again, in July 2022, the American Journal of Clinical Genetics. So they cover the literature, the whole spectrum of literature, and I think they do a great job. This was a recent one. Family groups play a key role in advancing autism research. How true. So in summary, autism is a collection of symptoms. Its prevalence is increasing, and we're recognizing more biological causes, genetic, environmental causes, mostly unknown at this point. There are many associated conditions with sleep and GI problems in particular. Stirring the pot, we have to stir the pot to find causes and specific treatments. A little bit about growth patterns in the brain in autism, and many possible approaches to research and treatment. Questions?